let me give you a little background about myself. I did my medical school from Bombay, Lokmanya Tilak, and then I did my MD in internal medicine from the same place. I was a lecturer in internal medicine for a while, and then I did my DM in nephrology from KEM Hospital, Bombay. After completing my DM in nephrology and DNB in nephrology, I was a lecturer at the same place for a while. And during that time, during all these 5, 6 years, I tried to save money so that I could write my USMLE exams. Mind you, at that time, we had to take a trip abroad. I had to go to Singapore. I had to go to Manila to write, Hong Kong to write the exams, and it was a huge financial undertaking. At my time, a house officer's salary was 1,500 rupees. So to save from that, and I think a trip abroad to write a exam was about 60,000 rupees. So I did that, and then I came for a fellowship here, and subsequently, I'm here practicing as a nephrologist, as a transplant specialist. And I can tell you one thing, that the journey, though for me it was 6 years of postgraduate training after MBBS and then repeating a fair bit of that here, the journey has been satisfying. Now I am in the space of foreign medical graduate training, education, guidance, mentoring, USMLE platforms. We have USMLE products to help the students. We have observerships to help the students. So I think if you are steadfast, if you are patient, um, and if you do in the hard work, you will have a very satisfying 30 years from now. You would be sitting in my chair and telling the same to the next generation of students. So Pooja and Manjushri, do you want me to start off with anything in particular, or do you want me to field the questions and answers?
I guess you can start, sir, with about clarifying, the steps of USMLE and about the tips that you would like to give the students about preparation and about the resources as well.
Okay. So let's start with USMLE. You are a medical student. Lot of students will ask, what is the right time? When should I write the USMLE exams? I've gone through the medical education system in India. First MB is 1.5 years, then another 1.5 years, then another 1.5 years. The best time for you to write the step one exam is after you have completed 3 years of medical school. So you have covered anatomy, physiology, biochemistry. You have been taught pathology, pharmacology, microbiology, and forensics, and some of biostats, right? That is what the curriculum of medical school is in India. So after you have finished your second MBBS, that is 3 years of medical school, that is the best time to write your step one. At the end of second MB, study NBME series or subscribe to the preparation products for step one. Take a shot at it in 2 to 3 months, because you are fresh with all the knowledge from the medical school. You have supplemented that. What is being asked in step one, you should be able to pass. Now, step one is just pass and fail. Now, there is no scoring, there are no scores. So, you just need to pass. You have passed that, you focus your attention on your medical school third year, do your clinical sciences, medicine, surgery, OBGYN, pediatrics, everything, give your final exam, then you enter internship, right? In the first 3 to 4 months of internship, sit down, study USMLE 2. You are fresh with all the clinical sciences that are needed in step 2, and you are preparing for step 2. A dedicated preparation is needed, at least 6 to 8 hours per day. And that you can do while doing internship. You can slog in so many hours and do that. So 4 months, give step 2 exam Within the first 6 months of your internship, you're done with step one, you're done with step two, and then during, so now you have an option to extend your internship. You need not finish at the dedicated time. Tell them that I want to finish my internship, I'm going to take a break for 6 months or 3 months, and then finish my internship 3 months later. Why? Because during this time you're still a medical student and you can come for electives. There are a couple of types of United States clinical experiences. One is and these are called as clinical rotations in US. One is observership, wherein you don't get to do anything, you just are with a physician on their rounds, you just observe, look and observe, you're not able to do anything, right? And that's a last resort. If you and that is usually for people who have finished their internship, who